President Nixon today pledged his administration to a new national health plan that would benefit not only patients, but also doctors and citizens who enjoy good health. But beating him to the punch, Senator Edward Kennedy earlier proposed an alternate plan that goes much further than the administration. Daniel Shore offers a comparison of these two health plans.
President Nixon has said that this will be Health Year, the year to tackle what is called the massive crisis of spiraling costs and overstrained medical resources. Today, the president pitted a low-key, low-budget plan to expand private insurance coverage against the more drastic proposals in Congress paced by the labor-supported Kennedy plan for cradle-to-grave federal health insurance for all Americans.
I am proposing today a new national health strategy. It helps more people pay for care, but it also expands the supply of health services and makes them more efficient. It emphasizes keeping people well, not just making people well. The purpose of this program is simply this. I want America to have the finest health care in the world, and I want every American to be able to have that care when he needs it.
The President's program, as announced it today as a National Health Partnership program, I believe is really a partnership program that'll provide billions of dollars to the health insurance companies. It's really a partnership between the administration and the insurance companies. It's not a partnership between the patients and the doctors in this nation.
The administration proposal would provide different plans for 4 categories of Americans. For 150 million working people and their families, employers would be required to buy health insurance providing a basic package of benefits, eventually they paying 3/4 of the premiums. For some 20 million of the working poor and their families, the current free Medicaid services would be replaced by private health insurance fully paid by the government for the poorest, with a sliding scale of contributions for families earning more than $3,000. For the 21 million aging Americans, the $5.60 monthly Medicare premium for optional doctor services would be dropped, Social Security taxes adjusted to make up the cost. For some 30 million domestic, self-employed, and others, lower costs by being enabled to buy policies at group rates from insurance pools. But hedged with deductions, co-insurance features, the plan is estimated to cover less than half of the average patient's health expenses and to cost the federal government less than $2 billion in addition to what it's now paying. By contrast, the Kennedy plan would cover an estimated 70% of health expenses through a system that would cost the government up to $60 billion, but including a lot of what patients are now paying. The Kennedy bill is straight national health insurance, financed by Social Security and general taxes, with no cost sharing, no cutoff point for the beneficiaries, bypassing private insurance companies, operating through a presidentially appointed health security board. And so the line is being drawn between repairs on the present health system and a new federal health system. The debate starts next Monday, when Welfare Secretary Richardson is scheduled to appear at the opening of hearings of the Senate Health Subcommittee. The chairman of that subcommittee now, Senator Kennedy. Daniel Shore, CBS News, Washington.
One of the most worrisome problems facing Americans these days is the cost of health care and the rate at which it has increased. 24 years ago, the total cost of medical care was $12 billion a year. By this year, the cost will reach $100 billion a year. Today, Caspar Weinberger, Secretary of Health, Education, and Welfare, went before the House Ways and Means Committee and urged Congress to move quickly on the administration's health insurance plan. But there are some deep differences in the plan put forward by the administration and that proposed by Democrats in Congress. And Catherine Mackin has that story.
Secretary Weinberger says that health insurance is vitally needed and long overdue. Weinberger has the job of selling President Nixon's newest and biggest proposal for national health care. If he can't do that, he will have to settle his differences with Congress, and most of the negotiating probably will center on the health insurance plan proposed by 2 important Democrats, Congressman Wilbur Mills and Senator Edward Kennedy. They presented a new bill 2 weeks ago. It was modified to get more backing. Their compromise brings it close to the Nixon bill, but major differences remain. The Nixon plan is voluntary. This means some poorer and younger people may choose not to join. Much of the insurance will be financed through company plans, with employers paying 75% of the cost and workers 25%. Each family would have to pay deductibles on medical bills, just as in car insurance, up to $450 a year. In major illness, once bills hit $1,500, insurance would pay all other bills. With Mills Kennedy, coverage is compulsory. Through Social Security taxes, employers pay 75% of the cost and workers 25%. Deductibles are limited to $300 a family. In major illness, after $1,000 in bills, insurance takes over. The total cost to all parties under each bill is about $40 billion. Under Mills Kennedy, the federal government manages much of the program, with private insurance companies playing less of a role. It is on this point that the two sides could lock horns. The administration plan would channel as much as $37 billion through private health plans like Blue Cross. The administration says it will not compromise on private management. While these two plans cost a lot, they don't give full medical coverage. The plan that does that is the one proposed by the National Committee for Health Insurance. This plan would pay for virtually all illnesses. It would cost over $80 billion and would be financed by corporate and payroll taxes. It's supported by all the major unions.
The American people have shown repeatedly through polls that they insist health care has to be a matter of right. The only way that can be done is through a universal system. And compromises that throw away universality are just unacceptable. We prefer to see nothing come out of this Congress than that kind of compromise.
A lot of differences, some of them very big, still have to be worked out. But the feeling is that the hearings on health, which started today, will end with passage of a national health insurance plan, either late this year, but certainly no later than next year. Catherine Mackin, NBC News at the Capitol.